stone unturned. Leave your fears behind.
Leaving no stone unturned. It's time for truth in matters directly affecting you, America. You have a voice, and it's time to use it. It's time to Speak Now Live with Cheryl Edwards.
All right, we're back with Gwen Olsen, and she's got the book, Confessions of an RX Drug Pusher. And Gwen, I'm so happy that you're here with us today, and we're talking about the FDA and what they need to put drugs on the market. And there are so many. They don't need a whole lot.
No, they don't need a whole lot. And unfortunately, a lot of the clinical trials are conducted in third world countries where the manufacturers just throw down millions of dollars at these, third world countries and say, we're looking for this or that result. And, of course, they very frequently will get that result, or the clinical trial will actually be ran until they do get the positive results that they're looking for. And another thing a point that I'd like to make about clinical trials is that doctors very frequently will get their information out of their peer-reviewed journals, such as the New England Journal of Medicine or the Journal of American Medical Association, things of that nature. And quite frankly, the pharmaceutical industry doesn't publish everything. They don't publish all of their trials. They only publish the positive trials generally, and they only publish the positive endpoints of trials. What that means is that they will run a trial for, say, 4 to 6 weeks, and then when they start to get the positive results from the drug, they will report that as the endpoint, and they'll stop the clinical trial. They do the same thing if they start to see excessive side effects surfacing. If you start to get a huge number of side effects, they'll end the clinical trial at that point because they don't want to have to report the bad things that come up to the FDA. So when a drug hits the market, a new drug, you have less than 50% of the side effects that have been reported about that drug because, first of all, they aren't clinically tried in children. They aren't clinically tried generally in females of reproductive age. They aren't tried in Asians or other kinds of minorities because we want the trials that are going to look the very best to be the ones that are submitted to the FDA so that they have a minimal amount of data to combat the use of that drug when it first comes on the market. That's the reason we see so many excessive side effects that surface later on down the road.
Now, there's a lot of fraud and racketeering. I read your book. It's phenomenal, and I want to recommend that to the listeners. If you want to know more about what the government is, or I should say who's doing this, Gwen?
Everyone's doing it. The government is in collusion with the pharmaceutical industry. Unfortunately, the politicians are very well funded. The pharmaceutical industry has very deep pockets. They even tell their representatives who to vote for, who they think that is the best candidate for the industry. So, it's just it's a hand-in-hand thing. Many of the FDA people are waiting to retire and go into the pharmaceutical industry in consulting positions. And you can kind of just watch that revolving door between government positions and between the pharmaceutical manufacturers. Even Donald Rumsfeld has been a CEO on several pharmaceutical company boards. Amazing. Now, you were talking about fraud, and one of the stories that I read in your book that caught my attention was the Eli Lilly. Is that right? Which one? Which
one? That's pretty bad. It was the reading about the movie in the Fugitive movie when people were dropping dead.
When they were. Well, that was actually about. I'm trying to remember. The Fugitive was about liver, wasn't it?
Yes.
That some patients were having liver failure. Well, that was just something that had hit very close to home because Eli Lilly had a product that had also caused those problems a few years prior to that. So the reason I put that in the book was just to show that may have been a Hollywood movie, but it was actually taken from a real-life incident like many of the Hollywood movies are,
right.
Where that a pharmaceutical company, just like The Constant Gardener, if you haven't seen The Constant Gardener, I recommend that people go rent that at Blockbuster and watch that movie. It's presented as though it's not factual, but it's based on facts. So that's one of the things, because many times, you can't call the pharmaceutical industry out on the carpet. Many people are afraid to confront them because their deal is they will sue people and that they will destroy reputations. They try to destroy people's credibility the best that they can. And that's one of the reasons why, quite frankly, that I'm speaking out the way that I am. I don't really have a whole lot to lose. I don't have letters behind my name. I've given up I've forfeited my 401ks for this work because I've signed confidentiality agreements that I wasn't allowed to speak out. And quite frankly, I didn't want the blood money on my hands anyway, so I've spent all the money that I made in the pharmaceutical industry and then some. But it's just one of those things that there is a lot going on behind the scenes that people need to do their own due diligence. I don't expect anyone to take what I'm giving them today for face value, and I don't think that they should listen to anyone, even you, and take what they're saying for face value. People need to start thinking more critically, intelligently. We need to start asking questions, and we need to start doing our own educating, self-educating, because we're being lied to.
Yes.
We're being lied to on a consistent basis via advertising, mass advertising, and we're being lied to by people who are using us as a profit center. And most importantly, and this is my big message to your listeners, they're using our children as a profit center.
Yes.
And they have targeted our children as their biggest expansion market, and they are going after our children in large numbers. And parents had best be aware, because they will be burying children, and they will be having autistic children. They will have children with deteriorating health problems as the years go by, and they'll look back and they'll say, gee, I shouldn't have taken someone else's word for this. It was my responsibility as the parent to know what I was doing.
Yes. Speaking of that, in 1994, my son was diagnosed with ADHD, and he, of course, was given some. I was given some Ritalin to give to my son, and I gave him Ritalin. Make a long story short, they tried him on Ritalin and Wellbutrin, and I can't recall which drug it was, and I'm thinking it might have been the Wellbutrin. One morning I woke up in the middle of the night, and my son was banging his head into the wall, and I couldn't, for the life of me, couldn't figure out what the thumping noise was, and went in there. Bless his heart, he's sitting on the bed, just banging his head into the wall, and I took the bottle of pills, and it had to have been... it had to have been God, because I dumped the pills in the toilet. It was done. I was done with the pills, and I never once gave him another pill. And it's just kind of...
I hear that quite frequently from people, from children, particularly who are autistic, that are put on these drugs. They do head banging, and one of the reasons that I've discovered that exists is because people will frequently hear voices in their head when they take these drugs, when they're having an adverse event. They become psychotic, and they actually hear voices in their head. So that's one of the reasons that children will bang their head against the wall.
Oh, dear. So, as far as what do you think about vaccines? I mean, should kids get vaccinated? That's a big topic, and
Okay, well, now, vaccines are not my area of expertise. However, I have been doing a lot of my own research, particularly into the Gardasil vaccines, into the flu vaccinations, and all of that. I haven't, quite frankly, been able to do all of my due diligence on every vaccine that's out there, but I know there's a lot of controversy, and has been a lot of controversy about the annual flu vaccines. And so I started looking into those just to see what is the mortality, morbidity rate. If you want to see if a product is efficacious, if a drug is efficacious, or a vaccine is efficacious, you should be able to go back and look at mortality and morbidity and say, okay, well, mortality and morbidity went down with this particular product. And if it did, then that means it was efficacious. If it did not, then that means it was not efficacious. Well, when you look at children particularly, they were not given flu shots prior to 2003. Children were always excluded from the annual flu shots because they were thought to get enough exposure in the school setting and playgrounds and things of that nature that they didn't require them. Well, if you go and you look at the data, there has been an increase in mortality and morbidity in children with flu since we started vaccinating them. There has not been a decrease. So that sends up a red flag. We should look into that. We should also look into, like, the Gardasil vaccines and find out what is the controversy around the Gardasil vaccines. Why are they pushing them on our children? Why are they trying to make them mandatory in order for children to attend school? These are the questions that we have to start asking as, caretakers for these children. And also we have to start looking at what the money trail shows us. What are the most profitable drugs right now for the pharmaceutical industry? I bet that most people are not even aware that for 3 years running, the most dispensed and the most money made off of a drug for the pharmaceutical industry was antipsychotics. Now think about that. The number one 3-year running money maker and dispense products being antipsychotics. Are there that many crazy people out there? Or do we have some sort of an agenda to get enough people on psychiatric drugs that don't require any kind of medical tests or anything? They just require a third party's intervention to make an observation that someone has maladaptive behaviors, and therefore they can put them on drugs and give them a label, and they don't require any medical tests. It's a huge scam, and people had better start waking up to what this agenda is about.
Wake up. That's right. We'll be right back with more with Gwen Olsen right after this.
Leave no stone unturned. Leave your fears behind.
You've been listening to Speak Now Live with your host, Cheryl Edwards. All views and opinions expressed on this show do not reflect the views of this station. For further insight and a recap of today's show, visit SpeakNowRadio.com. Speak Now Live with Cheryl Edwards, Saturdays at 1 on WFEN.